How important is testosterone for men and testosterone supplementation?
It's very important. I mean, testosterone is the predominant sex hormone in men. It's produced in the testes, and as you get older, the levels go down. When they go down, you just don't feel like you're on your game anymore. You start losing that competitive edge because you get a little bit of brain fog, a little mental decline. You definitely feel fatigued, tired, less energy, and so it's just hard to keep up. You can't work out. If you work out, you just don't feel as well. So testosterone really helps keep men youthful. It helps.
You take testosterone.
I do.
And I know your age, and you look 10 years younger than your age. You think testosterone has something to do with it?
It's not hurting. I can tell you that much, Randy.
Okay.
I mean, I feel good. When I'm on testosterone, I feel good. Matter of fact, some people think that testosterone, because bodybuilders use hormones, that it makes you mean and roid rage. It's actually the opposite. I actually start to get a little bit cranky when my testosterone level goes up. And my wife says, did you skip your testosterone shot? Okay. Because actually men, we make our estrogen from testosterone. It's called aromatization. And so when the testosterone level goes down, the estrogen levels go down. Estrogen is the more nice hormone. It's the ones that actually make men feel better. But when the testosterone level goes down, then the estrogen level goes down, and you're not.
So men need a little bit of that ratio of testosterone and estrogen.
Yes,
to feel
in men,
the best.
Testosterone is the predominant sex hormone, but they need estrogen as well. And testosterone is going to help men reduce the risk of Alzheimer's, reduce the risk of cardiovascular disease, increase their bone health, and really help them thrive as they get older.
So what about the increased risk of prostate cancer when you take testosterone?
Fortunately, there is none. The large meta-analysis showed that after evaluating 197 separate studies, there was no increased risk of prostate cancer by supplementing yourself with testosterone. However, it tended to be that the men with lower testosterone had increased rate of prostate cancer and increased rate of more aggressive prostate cancer.
Okay, so you need a little bit of testosterone, and it's protective.
It is. You need it. It's. You think about this. When you're 20 and your testosterone is the highest, you don't get prostate cancer. So you can't make this conclusion that prostate cancer is from high testosterone, because it's when you get older and your testosterone level goes down, that's when your incidence of prostate cancer elevates.
But what about, they say that with testosterone in men, you could lose your hair.
That incidence is actually only about 1%. And again, like all the hormones, you need to prescribe them appropriately. If you're not going too high, not going too low, you're going to minimize the risk. And the risk of hair loss is actually very low with the appropriate dose of testosterone. So not only does testosterone help men, feel better, you don't have that fatigue of the nurse, but improves your libido. I mean, it's not uncommon for men in their 40s, 50s, 60s to really have their libido really drop off. And they're missing out on an important part of life. I mean, sex is one thing that we can be intimate with our partner that allows us to be human, allows us to live, to thrive. And so I think it's very important that men continue to have libido, and testosterone significantly increases libido in men. So testosterone is really important for men's sexual health. It does several things. One, it actually helps increase the sexual desire, for one, which is the starting point, right? And then it also helps increase the quality of erections, which is important. And it also helps men remain confident about their physique, because it's anabolic. It helps build muscle. Builds muscle, builds bone.